Welcome back to another edition of Cannabis in Canada with Jason Wilcox. I have the pleasure of sitting here today with Jamie Shaw, who is the spokesperson for the British Columbia Compassion Club Society, arguably the oldest compassion club in British Columbia. And as well, we're going to be talking a little bit about the CMACD. Jamie, welcome to the show.
Hi.
First off, maybe tell us a bit, what is the CMACD?
It's the Canadian Association of Medical Cannabis Dispensaries.
Okay. And your present work now with them is?
Well, we're running the certification program, and so it's we've got standards that dispensaries have to meet that are based around patient access and issues that patients care about. Patients first in the healthcare system is kind of our view.
Excellent. Now, there's been an explosion of clubs here in British Columbia. We went from a handful to, 40 or something clubs now.
58 at last
58.
count.
Well, okay, so.
And counting.
So how do you think this is going to play out with the MMPR system that's come in, the clinics that are kind of popping up, and as well, again, the present situation with clubs in general, with all these clubs popping up and the CMACD in place? Are you noticing that they're coming to the CMACD to follow those guidelines?
Absolutely, there's a lot of interest in that. We've just actually launched the certification program, and next week will be the very first on-site survey. But there is a lot of interest in it. There's also some that aren't interested in it. In BC, we've got kind of a unique situation where some of the dispensaries aren't necessarily so much for the medical side, but they are very much in line with Vancouver City's harm reduction policies in general.
Yeah. That's a good point. The harm reduction, because I see a lot of dispensaries swinging that way, and I often wonder what will happen if we legalize with the dispensaries. As a president of the CMACD, what would be your outcome or your forecast for a legalization market? Because if it was to drop down to the provinces, what do you think BC's position would be? Potentially. Again, it's a tough projection, but especially
what we'd like to see is what we can say, and seems to be in line with experience here in British Columbia, which is we'd like to see patients being able to grow for themselves. We'd like to see community-based distribution, so not necessarily nonprofits, but some sort of dispensary model where people can get face-to-face education, and there's the support there and all the other services that dispensaries provide.
And that lends more credence. I know you wear two hats, so putting your other hat back on, spokesperson for the British Columbia Compassion Club Society. Now, your work with them, of course, you've learned a lot over the years on exactly what patients' needs are for different ailments, and that information just doesn't seem to be resonating with the federal government's scheme and trying to even morph what's in place now together with their system. Has there been any dialogue with the CMACD and the federal government, the MMPR?
There was. We were consulting with them. It's interesting because they stopped talking to us, and that they now say that they never talk to any compassion clubs or dispensaries, but they still have transcripts of those consultations up in certain places. So they're saying something that isn't true. But basically, we kind of feel like they picked and choosed which pieces of our model that they could use without actually regulating dispensaries or apparently really caring very much for patients' needs. I mean, it's overwhelming. They want access in forms other than smoked cannabis. Government's not allowing that. And it's been bad for doctors too. One of the reasons why some dispensaries here are still going strong is that doctors actually prefer to send patients to the dispensaries that have been around, particularly the ones that have been around a long time, like Vicks and like us, that know a lot more about cannabis, and especially cannabis in its various forms.
But also have a track record. I mean, the Vancouver Island Compassion Club, as you mentioned, Phil Lucas, the founder, was one of my mentors early on. So, of course, I always give shout-outs to the Vicks, also in the way that they made sure that even if they only had a few strains on the menu, that they were always, what you got was what you paid for, you got the product that you paid for. And most important, they never put anything on the menu that would potentially harm a patient. And those are the kind of ethics and standards, and the BCCS has been this way as well. And there's few clubs that are doing that. What's your take on more holistically what clubs should be more doing, especially with all eyes being on us right now? What should clubs really be doing in Canada to help patients like myself and the people I represent, to better get access to their cannabis and at the same time stay off this new policy?
Well, it's hard because it means somebody's going to be putting themselves at risk. When the BCCCS was first founded, part of that was because we knew people were using it medicinally. There was a major health crisis going on in Vancouver with the HIV. Cancer rates were through the roof, and they were all kind of coalescing at the same time that dispensaries started forming. And it happened basically here and in the San Francisco Bay Area. So all around Puget Sound and San Francisco Bay. And part of that was putting ourselves where the patients were. People were having to go and buy from the black market. They didn't know what kind of quality that they were going to be getting, or if they found something that worked, it would work again next time, or if they would be able to get it again next time. And so the first compassion clubs and dispensaries really put themselves in the same place. So we were suddenly at the same risk of arrest. We were at the same risk of having a criminal record. And there's still a really strong activist bent in the dispensary community because that's where we came from, right?
And that's what I fear that they might be forcing us back to if they keep going the way that they're going. And this is why I'm looking for where the answers lie. You have a position with the CMACD where you have access to the clubs, and by extension really the growers, and this is where I think the federal government is really not looking at how many clubs actually supply medical patients in the province of BC alone. If the federal government is only supplying 10,000 people after a year of this MMPR, since April 1st, whatever, almost a year, so they've been in effect, and they still are only servicing 10,000 people, and they're looking to shut down the people who are actually helping us. And I guess for me, as a patient, it's interesting to have this opportunity to talk about this. But again, the dangers, the fire, the mold, the gangsters, as we know, is proven to be false. But how about the toxicity, the addiction, the no deaths? Why do they need to govern it and have federal oversight when people like yourselves have been in operation for how many years now? Like 14, 15 years?
18 in May.
18 years. There you go. 18 years you've been in operation, helping out thousands of patients. Nobody's ever died on your watch.
Well, not from cannabis.
Not from cannabis.
We do have an altar where we honor all past members because a lot of our members are palliative when they come to us.
I'm one of your not a founding member, but I'm one of your first 100 members.
I'm member 2000, so I'm up there.
Yeah, that was back when Hillary was at the old location and she was still getting busted and standing her ground and laying it down for activists to see what we see now. So it's just interesting moving forward. Now, what would be the message that you as a club owner and spokesperson for the British Columbia Compassion Club Society would like to get out to other BC clubs and other people who are basically looking how they want to help people? They're doing it from their homes, they're doing it from their apartments.
We've been working with Eden Medicinal Society and Dana Larson from Vancouver Dispensary and of course, Victoria Cannabis Buyers Club on Vancouver Island, and so I think we're starting to do that, and we're doing that through CAMCD, and basically we just would hope that people understand that having some sort of regulation, some sort of quality standards is important. It's important to patients, and it's important to the industry as a whole. So yeah, we would hope that people would be on board with minimum quality standards.
Exactly, and again, minimum quality standards, being a patient myself, the ethics, the privacy of what we're doing, and of course, knowing that patients are being treated right, that what they're spending from their disability check is actually going to their medicine, and they're not getting abused, and that's where I see that there needs to be some sort of regulation, but there doesn't need to be Molson Cannabis, if you have it, the MMPR, sole proprietor sort of takeover, and that's kind of going into 2015, legally we've got them, going to the SEC, as you mentioned, with Art versus Smith. We've got them going to trial over gardens, but there's nothing at all protecting compassion clubs from this onslaught of the MMPR.
Well, it's a very difficult question. There's a lot of overlapping things. I mean, really at its core, this is sort of an argument about basic rights and whether nature can be regulated or outlawed and whether plants can be medicine. So there's some really, really deep-seated fundamental arguments underpinning all of that. But I think if you look at certain places, it's interesting to see that a lot of the states that are now moving towards medicinal are basically choosing our model. In New Hampshire, you have to have a wellness center attached, like we do. And In New Jersey, they set up a really good, and again, this goes to the complexity of it, they set up a system that required something very similar. They were supposed to be nonprofits. Sounded like it was going to be compassion clubs, but then it ended up being major companies that were opening nonprofit wings and basically just kind of running that way. And so there's no easy solution to it, particularly while it remains illegal on a recreational level.
So yeah, that's what it comes down to. Is I guess that's where in lies the war. It's going to take somebody to make a move on one side or the other. It's something that I fear as a medical patient, and also for the people I represent, because should they choose to shut down the clubs through legislation and force us back underground, that just means that more patients have to then rely on corner street drug dealers than qualified people like the British Columbia Compassion Club Society they can come in and get their medicine. Not only that, they can get frontline advice. You can't get that on a mail order system. You can't get that just reading off the internet.
Exactly.
You know, it's something you can only get by working with the people. So as we move into 2015, I guess we have to just see what happens. My fear is that the MMPR, through their clinics, that they're going to start to pop these clinics up and try to argue reasonable access. And of course, more challenges are going to be launched. As you mentioned, there's many overlapping issues that need to be explored. Even the fact that cannabinoids themselves in the endogenous system has not been fully explored, yet they have a marijuana for medical purposes. How can it be medical when the country doesn't say it's medical? You know, which we've learned through our legal discovery. All said, Jamie, it was a pleasure talking with you. I don't know if there's more that you want to cover here. Where can people find the CMACD if they want to check out more?
Well, we're on Facebook, and our website is also a mouthful. It's www.camcd-acdcm.ca.
Wow.
Facebook's probably easier. You can find a link to our website there.
Okay, and for the British Columbia Compassion Club Society?
Also on Facebook, or www.thecompassionclub.org.
Perfect. Okay, and thank you for coming on the show.
Thanks for having me.
And yeah, stay tuned for more as we continue to talk about the MMPR and what effects this is having on the cannabis culture and the medical patients, and really the holistic atmosphere of Canada in relation to legalization, which is on the horizon, and the present day plight of medical patients and our supporters, such as the BCCS. We'll see you in the next movie. Cheers.